May 8, 1945. Victory in Europe Day. While millions celebrated across the Allied world, First Lieutenant Margaret Hayes stood in a forgotten corner of Bavaria, staring at 40 dying women that nobody wanted to save. She was a black nurse in a white man's army. They were German prisoners in an enemy's cage. What happened next would challenge everything both sides believed about who deserved to live. The smell hit Margaret Hayes before she saw them. Not death exactly, but something close. Something organic and wrong. The kind of rot that happens to living flesh when the body starts consuming itself. A sweet, sickly odor mixed with unwashed bodies and the acrid tang of infection seeping through broken skin and weeping wounds that refused to heal. She stepped through the doorway of the converted Wehrmacht barracks, medical bag in hand, and stopped cold. 40 women. Skeletal frames wrapped in threadbare gray uniforms that hung like shrouds on their emaciated bodies. Some lying motionless on wooden bunks, staring at the ceiling with hollow eyes that had seen too much. Others slumped against walls, too weak to sit upright properly, their heads lolling forward onto their chests. A few sitting cross-legged on the floor, staring at nothing, eyes glazed with the peculiar emptiness that comes from severe malnutrition and the slow shutdown of cognitive function. The barracks was dim and oppressive, windows covered with torn canvas that filtered the spring sunlight into a sickly yellow glow. A few electric bulbs hanging from wires provided weak illumination that cast long shadows across the concrete floor. The floor itself was cracked and stained with things Maggie didn't want to identify closely. Dark patches that could have been blood or waste or both. The air was stale and heavy, pressing down like a physical weight on her chest, making it hard to take a full breath. Captain Robert Thornton stood beside her in the doorway. White man from Georgia, 43 years old. Voice like gravel scraped over stone. Eyes like flint that showed no warmth or compassion. He gestured dismissively toward the women with a hand that held a battered clipboard covered in forms and papers. Routine exam, Lieutenant Hayes. Document their general condition. Standard POW processing protocol. Nothing complicated. Should take you maybe 2 hours if you're thorough. Just note any communicable diseases we need to worry about. Typhus, tuberculosis, that sort of thing. Otherwise, just write up general malnutrition and move on to the next task. Maggie looked at him, then back at the women, her trained medical eye immediately recognizing signs that went far beyond simple starvation. These women are in critical condition, sir. This isn't routine malnutrition. There are specific symptoms here that suggest something more serious. Thornton shrugged with theatrical indifference, the gesture conveying both dismissal and impatience. His southern drawl became more pronounced when he was annoyed. They're malnourished, Lieutenant. Everyone in Germany is malnourished right now. Hell, half of Europe is starving. The agricultural system is destroyed. Supply chains are broken. Food distribution is chaos. Just write it up as general malnutrition. Note general malnutrition, note any immediate communicable disease threats, recommend standard POW rations. That's all we need. Done and dusted. He turned to leave, his boots heavy on the concrete floor, paused at the doorway, glanced back over his shoulder with an expression that made his feelings and priorities perfectly clear to anyone paying attention. And Hayes? Don't waste time on them. Don't spend all day here. We've got real work to do that actually matters. Field hospitals got American boys coming in with complications from old wounds that aren't healing properly. Concentration camp survivors at Dachau need round-the-clock intensive care. Those people suffered terribly under these Germans. They're the priority. Focus your energy where it actually matters, where it counts. Understand? Real work. Where it matters. Where it counts. The words hung in the air like smoke after a gunshot, heavy with ugly implications about whose lives had value and whose didn't, about who deserved care and who could be left to die. Maggie watched him go, his boots echoing on the concrete floor as he walked away into the bright spring sunshine outside, leaving her alone with 40 dying women. She set down her medical bag carefully on a nearby wooden table that was scarred with scratches and burns from years of use. Took a slow, steadying breath to center herself. 28 years old, Army Nurse Corps, First Lieutenant, one of only 512 black nurses serving overseas in the entire European theater of operations. One of the precious few who'd actually made it to Germany before the war ended. One of even fewer who'd been assigned to actual medical duties, rather than relegated to laundry work or kitchen duty or cleaning services. She'd fought for 3 long years just to get this uniform on her back. fought against quota systems that deliberately limited black nurses to 160 total in the entire United States Army Nurse Corps, while the military desperately needed thousands more nurses. Fought against institutional racism that insisted black nurses weren't educated enough, skilled enough, professional enough, trustworthy enough to treat white soldiers. Fought against a military establishment that would rather let American soldiers die untreated in field hospitals than allow black hands to provide medical care. And now, here she was finally, after years of fighting for the right to serve, assigned to examine 40 white German women in a forgotten barracks because none of the white American nurses wanted this particular job, because this task was considered beneath them, unimportant, low priority, a waste of valuable time and resources. The kind of assignment you gave to the colored nurse because it didn't really matter what happened. Nobody cared about the outcome. The bitter irony wasn't lost on her. It burned in her chest like acid, familiar and corrosive. Margaret Louise Hayes had been born in Baltimore, Maryland in the humid summer of 1917, just as America entered the Great War in Europe, born into a rigidly segregated city where hospitals maintained separate white and colored entrances, where the quality of medical care you received, whether you lived or died from treatable conditions, depended entirely and absolutely on the color of your skin, where black patients were treated in basement wards with outdated equipment from decades past and overworked staff, while white patients just 2 floors above received the latest modern treatments in bright, clean rooms with attentive, well-rested care. She grew up watching this cruel disparity play out in her neighborhood day after day, watching neighbors die from preventable illnesses like appendicitis and pneumonia because black doctors weren't granted hospital privileges at white institutions where the equipment and medicines existed, and black hospitals were chronically underfunded, understaffed, and undersupplied. Watching childhood friends suffer because ambulances would literally drive past dying black people to reach white patients first, because hospital policy and city practice considered white patients more valuable, more worthy of urgent emergency care, more deserving of the limited resources. And then, in the bitter cold winter of 1935, when Maggie was 18 years old and full of dreams, it became devastatingly, painfully personal in a way that would shape the entire rest of her life. Her mother, Sarah Hayes, developed a serious infection after what should have been a routine minor surgical procedure, a simple appendectomy performed at the colored hospital across town. The surgery itself went fine by all accounts, a textbook procedure performed competently, but post-operative care was tragically inadequate due to chronic understaffing and lack of access to the newer antibiotics that white hospitals had in abundance. The infection spread rapidly through her bloodstream like wildfire. Within 3 days, Sarah was severely septic, her body fighting a desperate, losing battle against overwhelming bacterial invasion. 18-year-old Maggie, terrified and desperate, begged the prestigious white hospital, Johns Hopkins, to admit her dying mother for emergency treatment. They had the better antibiotics that could fight the infection. They had better modern equipment for monitoring vital signs. They had better trained surgeons who could perform emergency procedures if needed. They had absolutely everything needed to save her mother's life with relative ease. The admissions clerk, a thin white woman with cold eyes and an even colder heart, had looked at Maggie over her wire-rimmed spectacles and said in a flat, bureaucratic, utterly indifferent tone that Maggie would never forget, "We don't treat coloreds here, girl. Hospital policy established decades ago. There's a Negro hospital on the other side of town, 34th Street near the railroad tracks. They can help you there. Now move along, you're blocking the entrance." The Negro hospital was 45 agonizing minutes away by taxi through heavy traffic. Her mother didn't have 45 minutes left. Her organs were already shutting down one by one. Her breathing was shallow and rapid. Her pulse was thready and weak. Maggie had held her mother's hand desperately in the back of that taxi, watching helplessly as her mother's warm brown skin turned an ashen gray color, watching her breathing become increasingly shallow and labored, each breath a visible struggle against failing lungs, watching the light slowly, inexorably fade from her eyes, the warmth leaving her body even though her heart continued to beat weakly. Sarah Hayes died exactly 10 minutes before they reached the Negro hospital. She was 39 years old, a woman in the prime of her life. The bacterial infection was completely treatable with proper antibiotics and supportive care that were readily available just miles away. She died because of the color of her skin, Because hospital policy and social custom valued racial segregation over human life. Because white administrators had decided that maintaining racial purity in their facility was more important than saving a black woman's life. Maggie made a solemn promise that night, sitting alone in the back of that taxi with her mother's cooling body cradled in her arms, tears streaming down her face. A promise whispered through grief and rage. Nobody else would die from neglect if she could prevent it. Not if she had anything to say about it. Not if she could help it in any way. Not ever again if she had the power to stop it. She'd worked 2 exhausting jobs simultaneously to pay for nursing school, determined with fierce resolve to become the kind of nurse who wouldn't turn anyone away based on race or social status. She cleaned houses during the day for wealthy white families in the better neighborhoods, scrubbing floors and washing windows and doing laundry. She waited tables at night at a colored restaurant near the docks, serving food and cleaning up until her feet ached unbearably and her back screamed in protest. She saved every single penny with obsessive discipline, living in a tiny rented room barely bigger than a closet, eating the cheapest food she could find, wearing the same 3 dresses until they were threadbare and patched. She applied to 7 different nursing programs across Maryland and neighboring states. 6 rejected her outright with form letters that all said essentially the same thing. We don't accept colored students. Our facilities aren't equipped for racial integration. Have you considered practical nursing instead? It's more appropriate for girls like you. The subtext was always brutally clear. You're not good enough, you don't belong here with white students. Know your place in society. The 7th program, Freedman's Hospital School of Nursing in Washington, D.C., accepted her application in the fall of 1938. Freedman's was a historically black institution with a proud legacy, founded after the Civil War specifically to provide medical care and professional training for formerly enslaved people and their descendants. By the 1930s, it had evolved into one of the premier black medical institutions in the entire country, training doctors and nurses to the same rigorous standards as any elite white institution, sometimes even higher standards to compensate for the discrimination graduates would face. Maggie threw herself completely into her studies with an intensity that impressed even the demanding instructors. She was going to be excellent. Not just adequate, not just competent, but genuinely excellent. Outstanding. She studied human anatomy until she could draw every bone, every muscle, every organ system from memory with perfect anatomical accuracy. She practiced bandaging techniques and wound care procedures until her hands could work without any conscious thought, muscle memory taking over completely. She memorized drug dosages for hundreds of medications, surgical procedures step by step, emergency protocols for every common crisis, disease presentations and differential diagnoses. She graduated in the spring of 1940 with perfect marks in every single subject, top of her entire class, highest scores in the program's history. The instructors privately said she was one of the most naturally gifted students they'd ever had the privilege to train, with an intuitive understanding of pathology and patient care that couldn't really be taught. In January 1941, 2 months after graduation and full of patriotic fervor as war engulfed Europe, she applied to the United States Army Nurse Corps. She wanted desperately to serve her country in its time of need. Wanted to prove beyond any doubt that black nurses were just as capable, just as professional, just as dedicated and skilled as white nurses. Wanted to make a real difference on a larger scale, to save lives and demonstrate conclusively that excellence and competence had no color. The Army rejected her application with a polite, impersonal form letter. Thank you for your interest in serving with the United States Army Nurse Corps. Unfortunately, the quota for Negro nurses has been filled at this time. We encourage you to apply again at a future date, when positions may become available. Sincerely, Recruitment Office. Quota: 160 black nurses allowed in the entire United States Army Nurse Corps, out of nearly 30,000 total nurses serving. Less than 1%. Less than half of 1%. A deliberate, calculated policy designed specifically to maintain strict racial segregation and severely limit black participation in the military services. Meanwhile, the Army was desperately, critically short of nurses as the war expanded across multiple theaters. Meanwhile, white women with minimal training, sometimes just a few weeks of accelerated coursework, were being fast-tracked through emergency programs to meet the desperate demand. Meanwhile, American soldiers were dying preventable deaths in field hospitals and aid stations for lack of adequate medical care, and proper nursing attention. But the Army wouldn't lift the restrictive quota, wouldn't accept qualified, trained black nurses who were ready and eager to serve, because maintaining racial segregation in the military was considered more important than saving American soldiers' lives. Maggie applied again in March 1941. Rejected. Applied again in June. Rejected. Applied again in September. Rejected. Each rejection letter used the same polite bureaucratic language, hiding the same ugly racist truth. Your race matters more than your qualifications, your dedication, your skills, your patriotism. The Japanese attacked Pearl Harbor in December 1941. America entered the war fully and completely. The need for nurses became even more desperate and critical as casualties mounted in both the Pacific and European theaters. Maggie applied yet again in January 1942. Rejected again. The quota was still firmly in effect, still artificially limiting black nurses to 160 total, regardless of military need or individual qualifications. She applied every 3 months for 3 long, frustrating years. 12 separate applications. 12 separate rejections. 12 painful reminders that her country valued maintaining racial segregation more than it valued her skills or dedication or willingness to serve. During those 3 bitter years, the National Association for the Advancement of Colored People mounted a sustained, aggressive pressure campaign against the discriminatory quota system. The black press, major newspapers like the Pittsburgh Courier and Chicago Defender, published scathing editorials asking pointed, uncomfortable questions that white America didn't want to answer. How can you ask black men to fight and die for their country while simultaneously refusing to let qualified black nurses serve? How can you claim to fight for freedom and democracy abroad while maintaining Jim Crow segregation at home and in the military? How can you justify letting American soldiers die for lack of nurses while thousands of qualified black nurses sit at home, barred from service by racist quotas? Eleanor Roosevelt, the First Lady and a champion of civil rights, personally wrote multiple letters to military leadership and directly to the Secretary of War, strongly advocating for the immediate elimination of racial quotas in nursing. Black communities across the country organized protests, letter-writing campaigns, and public demonstrations. The pressure mounted steadily week after week, month after month. Finally, in January 1945, with the war entering what everyone hoped would be its final phase and nursing shortages reaching absolutely critical levels that threatened military operations, the Army reluctantly lifted the quota restrictions under intense political pressure. Black nurses could now apply without arbitrary numerical limits, supposedly to be judged on merit rather than race. Maggie applied for the 13th time in February 1945. This time, after 5 long years of trying and failing, after 5 years of rejection and frustration, she was finally accepted. She was processed through basic military training in March, shipped overseas aboard a crowded, uncomfortable transport ship in April, arrived in war-torn Germany in late April 1945, just days before the German surrender on May 8th that ended the war in Europe. 5 years of applications and rejections, 5 years of fighting just for the right to serve, 5 years of proving herself over and over and over again. And when she finally arrived in Europe, when she finally got the chance she'd fought so hard for, she quickly discovered that official acceptance didn't mean genuine equality or respect. She was still routinely assigned to segregated units separated from white nurses, still kept separate in housing facilities and mess halls, still given the undesirable jobs that white nurses considered beneath them or didn't want to deal with, still treated as somehow less than her white counterparts despite identical or superior qualifications. Jobs like examining 40 dying German POWs in a forgotten barracks that smelled of decay and death. Maggie looked at the women carefully now, forcing herself through sheer professional discipline to see them not as enemy combatants or representatives of Nazi Germany's evil, but simply as patients who needed thorough medical assessment. It was the core professional discipline she'd learned and internalized at Friedman's Hospital. Separate your personal feelings and prejudices from your clinical judgment and patient care. The women looked back at her with a range of reactions visible on their gaunt, hollow faces. Some with obvious suspicion, eyes narrowed and wary, clearly distrustful. Some with complete indifference born of utter exhaustion, too tired and weak to care who was examining them or what happened next. A few with barely suppressed open hostility that flickered in their sunken eyes, despite their obvious physical weakness and vulnerability. One woman in particular, maybe 22 or 23 years old with blonde hair matted with dirt and grease, stared at Maggie with something like profound confusion. Her brow was deeply furrowed, her expression showing clear cognitive dissonance and mental struggle, as if she couldn't quite process or understand what she was seeing, as if reality was fundamentally contradicting something she'd been taught her entire life. A black woman in an American officer's uniform with lieutenant's bars. A black woman with medical equipment and obvious professional authority. A black woman clearly in a position of power over white German women. Maggie knew that look intimately from experience, had seen it many times before on the faces of German POWs and captured soldiers who'd been fed years of intensive Nazi propaganda. The unmistakable look of someone whose entire worldview was being directly challenged by evidence they couldn't deny or explain away. Nazi racial ideology had taught Germans that black people were fundamentally subhuman, barely intelligent, inferior in every measurable way. The Nazi regime had deliberately pointed to American segregation, to Jim Crow laws and racial violence, as supposed proof of black inferiority, had cynically used America's own racism to justify and validate their murderous racial hierarchy. And now here was direct, undeniable contradiction standing in front of them. A black woman who was clearly educated to a high level, clearly professional and competent, clearly an officer in the most powerful military force in the world. It didn't fit the narrative at all. Maggie set her jaw firmly, squared her shoulders, and picked up her stethoscope with steady hands. She hadn't come here to challenge anyone's ideology or to educate Germans about the lies and evil of Nazi propaganda. She'd come here to do her job properly, to assess medical conditions thoroughly and provide appropriate care recommendations based on professional medical judgment. "I'm Lieutenant Hayes," she announced clearly and firmly, her voice carrying across the barracks with calm professional authority. Some of these women probably spoke at least some English. Most probably didn't speak much or any, but tone and body language were universal forms of communication that everyone understood. "I'm going to examine each of you individually and thoroughly. Medical examination to assess your current health status and identify any conditions requiring treatment. You will cooperate fully. If you don't speak English well enough, someone will translate for you." A few women nodded weakly in acknowledgement. Most just continued staring blankly. One or two exchanged quick glances with each other, silent communication passing between them that Maggie couldn't interpret. Maggie began methodically with the woman closest to her, the blonde woman who'd been staring at her with such visible confusion and cognitive dissonance. "What's your name?" Maggie asked, pulling out her notepad and pen to document everything thoroughly. Gerda Mueller." The woman's English was heavily accented and halting, each word carefully pronounced as if she was mentally translating from German first before speaking. "Age, 22 years old. What was your role in the military? What work did you do?" "I operated searchlight equipment for the Luftwaffe Air Force to find enemy aircraft at night when they came to bomb. I turned the big light to where the radar operators told me, helped the anti-aircraft gunners see targets to shoot down the bombers." Maggie nodded, making careful notes in precise handwriting. The Luftwaffe, Germany's Air Force, had recruited well over 500,000 women for various auxiliary roles during the war years. They weren't officially combat personnel under international law, but they performed absolutely essential support functions that directly enabled and contributed to the German war effort. They operated complex radar and radio stations. They manned the massive anti-aircraft searchlights that illuminated bomber formations at night for gunners. They plotted aircraft movements on large maps in command centers. They handled military communications and logistics. They performed crucial administrative work. Their dedicated service freed up hundreds of thousands of men for direct combat roles on the front lines. By the end of the war in May 1945, women were operating approximately 85% of Germany's entire anti-aircraft searchlight and radar network. They worked long, exhausting shifts in genuinely dangerous conditions, often becoming primary targets for Allied aircraft who wanted to knock out the searchlights and blind the anti-aircraft guns. "I need to examine you now," Maggie said professionally. "Sit up as straight as you possibly can." Gerda complied slowly and painfully, wincing visibly as she moved. Every small movement seemed to cause significant pain throughout her body. Maggie pulled out her stethoscope, the metal cold and familiar against her hands. She placed it carefully on Gerda's chest over her heart, listening intently through the thin, worn fabric of her gray uniform. The heartbeat was rapid and irregular. Tachycardia, approximately 110 to 115 beats per minute. Normal resting heart rate for a healthy adult was 60 to 80. This significant elevation indicated either severe anxiety, active infection, or serious cardiovascular stress. Given the overall context and other visible symptoms, probably cardiovascular stress from malnutrition. She moved the stethoscope methodically to different positions across Gerda's chest, listening carefully to heart sounds from multiple angles to get a complete picture. The rhythm was regular but dangerously fast. No immediately obvious murmurs or grossly abnormal sounds, which was somewhat encouraging, but the persistent speed was definitely concerning and indicated systemic stress. She checked Gerda's blood pressure next, wrapping the fabric cuff carefully around her painfully thin arm. The arm was so emaciated that Maggie had to wrap the cuff almost twice around. She pumped it up and listened intently with her stethoscope as she slowly, carefully released the pressure valve. 90/50. Significant hypotension. Normal, healthy blood pressure was around 120/80. This reading was dangerously low, indicating either severe dehydration, significant blood loss, or serious cardiovascular compromise from malnutrition. She examined Gerda's eyes next, gently pulling down the lower lid to examine the conjunctiva. The tissue was pale, almost completely white instead of healthy pink. Severe anemia indicating critically low red blood cell count. She shone her small penlight directly into each eye, checking pupil response. Pupils were reactive to light, which was encouraging for basic neurological function, but the whites of the eyes showed multiple small red spots. Subconjunctival hemorrhages, tiny broken blood vessels leaking blood into the eye tissue. She looked carefully at Gerda's hands next, taking them gently and turning them over slowly in the weak electric light to examine them from all angles, and stopped completely, her breath catching. Petechiae, dozens and dozens of them. Actually hundreds when she looked closely and systematically. Tiny pinpoint hemorrhages under the skin, each one marking precisely where a small capillary had ruptured and leaked blood into surrounding tissue. They covered Gerda's palms extensively, her fingers, her wrists, her forearms. Dark red spots against pale, almost translucent skin, like someone had carefully speckled her with red paint using a very fine brush. Maggie gently but firmly pressed on Gerda's forearm with her fingers, applying light pressure directly over the radius bone. The woman gasped sharply and jerked her arm back reflexively. "Does this hurt?" Maggie asked, though the answer was painfully obvious from the reaction. "Yeah. Yes, very much. My bones hurt constantly, all the time, day and night. Especially at night when I try to sleep. I cannot sleep because of the bone pain, bone tenderness, severe periosteal pain, absolutely classic symptom of advanced scurvy. Open your mouth as wide as you can, please." Gerda complied with obvious difficulty, opening her mouth wide. Maggie shone her penlight inside carefully, examining the entire oral cavity with systematic thoroughness. The gums were severely swollen and intensely inflamed, bright red and puffy with infection. Gingivitis so severe it was rapidly approaching tissue necrosis. Fresh blood pooled visibly around several teeth, active bleeding from multiple points along the gum line. Some of the teeth looked distinctly loose in their sockets, shifting slightly and unnaturally when Maggie gently touched them with a wooden tongue depressor. Advanced periodontal breakdown, left completely untreated for even a few more weeks. Many of these teeth would simply fall out. Maggie examined Gerda's tongue carefully. It was smooth, pale, and abnormal. The normal papillae were completely atrophied, giving it an unnaturally smooth appearance. Another clear sign of severe, prolonged nutritional deficiency. She moved to Gerda's hair next, running her fingers through it very gently, examining the texture and structure carefully. The hair was extremely brittle and dry, breaking easily between her fingers with very little force, completely lifeless. And there, clearly visible under the focused beam of her penlight when she examined individual strands closely, were characteristic corkscrew hairs. Individual hairs that grew twisted and tightly spiraled instead of straight because the body couldn't produce proper keratin and collagen anymore. They looked like tiny metal springs or coils emerging from the scalp. She moved down to examine Gerda's legs, carefully rolling up the pant leg of her worn gray uniform. The fabric was badly stained and worn thin in multiple places from months of hard use. The skin on Gerda's legs was severely mottled and discolored, showing large, irregular patches of darker and lighter areas where circulation was failing. But much more significantly and alarmingly, there was profound edema, massive swelling so severe that the leg looked grotesquely inflated, easily twice or more its normal healthy size. The skin was stretched extremely tight and shiny, almost translucent. When Maggie pressed her finger firmly into the swollen flesh and held pressure for 5 full seconds, then removed it, a deep indent remained in the tissue. She watched and waited. 30 seconds passed. 45 seconds. The indent still didn't bounce back at all. Severe pitting edema. The tissue had completely lost its normal elasticity. She checked Gerda's other leg thoroughly. Exactly the same massive swelling and pitting edema. She checked her arms carefully. More petechiae scattered extensively across the skin, more bruising in various stages of healing, ranging from fresh purple to fading yellow and green. She examined old wounds and injuries. Gerda had a significant cut on her hand that looked at least 2 or 3 weeks old judging by the edges, but it absolutely hadn't healed at all. The edges were still completely open and raw, weeping slightly with clear, serous fluid. No scabbing, no new pink tissue formation, non-healing wounds. Without adequate vitamin C to produce collagen, the body literally couldn't repair even minor tissue damage. Maggie stepped back, her trained medical mind already rapidly assembling and analyzing the complete clinical picture. She made extensive, detailed notes in her pad, documenting every single finding with clinical precision and thoroughness. Then she moved methodically to the next woman in line, a brunette, maybe 25 or 26 years old, who said her name was Anna. She'd been a factory worker in a munitions manufacturing plant. Exactly the same constellation of symptoms. Petechiae scattered across her hands and arms like stars in a constellation. Severely bleeding gums when Maggie examined her mouth thoroughly. Fresh blood welling up continuously from badly inflamed tissue. Profound edema in her legs causing massive swelling. Severe pitting that left deep indents lasting over a minute. Excruciating bone tenderness throughout her body that made her wince and cry out softly when Maggie palpated her arms and legs to assess. Third woman, Elke, 29 years old, radio operator for military communications. Same exact pattern of symptoms and findings. Fourth woman, Hilda, administrative clerk in a Wehrmacht office. Same diagnostic findings throughout. Fifth woman showed additional, deeply concerning symptoms on top of the scurvy. Her name was Margaret, 31 years old. When Maggie asked her simple, basic questions about orientation, she struggled visibly to answer, her brow furrowing deeply with obvious mental effort. She couldn't remember what day of the week it was, couldn't remember how long she'd been held in this facility, couldn't recall her home address in Germany. Her eyes were unfocused and glassy, having serious trouble tracking movement or focusing on objects. Significant cognitive impairment. Neurological involvement. The deficiency was affecting brain function directly. Sixth woman, Frida, 24 years old, had severe peripheral neuropathy affecting her extremities. When Maggie tested sensation in her feet by touching them lightly with a sterile pin, Frida couldn't feel it at all. Complete numbness and loss of sensation below both ankles. When Maggie tested her deep tendon reflexes using a small rubber hammer to tap her patellar tendon, just below the kneecap, there was almost no reflex response at all. The peripheral nerves were badly damaged, completely failing to transmit signals properly from the spinal cord to muscles. The seventh woman Maggie examined was the oldest patient so far, somewhere between 38 and 40 years old. Her name was Elsa Schneider. She showed all the same severe scurvy symptoms that the others displayed, but also something additional that made Maggie's medical concern deepen significantly into genuine alarm. Her legs were massively, grotesquely swollen beyond anything Maggie had seen yet. Not just severe pitting edema, but truly profound, dangerous accumulation of fluid. The tissue was engorged to perhaps 3 or even 4 times normal size, stretched so tight the skin looked ready to literally split open. When Maggie listened carefully to her heart with the stethoscope, she heard distinctly abnormal additional sounds. A pronounced third heart sound, an abnormal S3 gallop rhythm, clearly indicating left ventricular failure. When she listened carefully to her lungs, moving the stethoscope across her back, she heard obvious wet crackles and rails at both bases. Fluid was actively accumulating in her lungs. Congestive heart failure from wet beriberi. The severe thiamine deficiency was causing her heart muscle to progressively fail, unable to pump blood efficiently anymore, causing fluid to back up dangerously into her lungs and extremities. This particular woman might not survive more than 10 days to 2 weeks even with immediate aggressive intervention. Without any treatment at all, she might die within days. By the time Maggie had thoroughly and systematically examined all 40 women, spending nearly 4 intensive hours on the comprehensive assessment that Captain Thornton had casually dismissed as a routine 2-hour task, a cold, absolute, unshakable certainty had settled deep in her chest like a stone. This wasn't simple generalized malnutrition, the kind of basic starvation affecting much of defeated occupied Germany. This wasn't just inadequate calories or insufficient protein intake. This was very specific. This was advanced, life-threatening vitamin deficiency disease. Multiple severe vitamin deficiencies working together in deadly concert to systematically shut down these women's bodies organ by organ, system by system. Scurvy. Advanced scurvy approaching the terminal stage. Stage 3, possibly early stage 4 in the worst cases. The ancient scourge of sailors, the disease that had killed more British seamen than combat during the age of sail before James Lind discovered the cure. The disease that modern medical science thought it had completely conquered through basic nutritional education. But scurvy wasn't just a relic of distant history found in old medical textbooks. It remained a very real, very deadly disease that occurred predictably whenever human beings went extended periods without adequate vitamin C intake. The human body, unlike most mammals, cannot synthesize ascorbic acid internally. Humans must obtain vitamin C from external dietary sources, primarily fresh fruits and vegetables. Without sufficient intake over time, the body progressively loses the ability to produce collagen, the essential structural protein that literally holds human tissue together. Blood vessels weaken progressively and rupture. Connective tissue throughout the body breaks down. Wounds cannot heal. Internal organs begin to fail systemically. In the complete chaos and widespread destruction of 1945 Germany, with agricultural production systems destroyed by years of total war, transportation networks thoroughly shattered by relentless Allied strategic bombing, supply chains collapsed entirely, and food distribution networks in complete disarray, scurvy had returned from the pages of history books to kill again in the modern era. But that wasn't the only serious deficiency disease Maggie was seeing in these patients. Multiple women also showed clear, textbook unmistakable signs of beriberi, vitamin B1 deficiency, thiamine deficiency. This disease manifested classically in 2 distinct forms: wet beriberi, which caused severe cardiovascular problems, heart failure, and massive fluid retention as the heart progressively failed, and dry beriberi, which caused peripheral nerve damage throughout the body, numbness, progressive muscle weakness, and serious cognitive problems as the nervous system degenerated. Beriberi had been a catastrophic public health problem in many Asian countries during the late 19th and early 20th centuries, particularly in populations that relied almost exclusively on polished white rice as their primary staple food. The industrial polishing process, which removed the outer bran layer to create refined white rice that was considered more desirable and higher status, also unfortunately removed nearly all the thiamine concentrated in that outer layer. Without that absolutely essential B vitamin, human nerves progressively degenerated, muscles wasted away, hearts failed. The Japanese Imperial Navy had suffered a truly catastrophic beriberi epidemic in the 1880s and 90s, losing thousands and thousands of sailors annually to the mysterious disease until naval surgeon Takaki Kanehiro brilliantly figured out through careful observation that diet was the fundamental cause. Now in 1945 Germany, where extreme food scarcity meant that whatever little food did exist was heavily processed to extend shelf life as long as possible, where fresh foods and whole grains were essentially completely unavailable to most of the population, beriberi had returned from history alongside scurvy to kill again. 2 ancient diseases from dusty medical history books, diseases that modern nutritional science had essentially solved and conquered decades ago, were now actively killing 40 women in a POW camp in Bavaria in the modern era. Maggie sat down heavily on a rickety wooden stool near the barracks entrance, her legs suddenly feeling weak and unsteady. She pulled out her notepad and began making detailed calculations and projections, drawing extensively on her comprehensive training in nutritional pathology at Friedman's Hospital. Scurvy develops in predictable, well-documented stages over time. Stage 1 begins approximately 30 days after vitamin C intake drops consistently below 10 milligrams per day. Initial symptoms include generalized fatigue, weakness, irritability, and vague joint pain. Stage 2 appears around 60 days of continued severe deficiency. This brings noticeable bleeding gums, petechiae, easy bruising, and more pronounced. If Margaret Hayes' story of courage and compassion moved you, please take a moment to like this video and subscribe to our channel if you haven't already. Your subscription helps us continue bringing you these powerful, untold stories from history that deserve to be remembered, and we'd love to hear from you in the comments below. What did you think of Lieutenant Hayes' decision to defy orders and save those 40 lives? Have you ever had to make a difficult choice between following rules and doing what you believed was right? Share your thoughts, and let's keep this important conversation going. Remember, history isn't just about the past. It's about the choices we make today and the legacy we leave for tomorrow. Just like Margaret Hayes chose compassion over hatred, we can all choose to be better, to heal instead of harm, and to stand up for what's right even when it's difficult. Thank you for watching, and we'll see you in the next video with another incredible story that changed history.